just a flesh wound.
It's alive!
You can't handle the truth.
Go ahead. Make my day.
Say, all right.
Always live in awe of the glorious mechanism of the human body.
Hello, and welcome back to another episode of the Soft Tissue OT podcast. My name is Jordan, the Soft Tissue OT. In today's podcast, we are diving into the topic of spinal discs, healing, nutrition, and how they actually get their nutrients supplied. So spinal discs are a fascinating structure. They are a dynamic fabric joint, is what we classify them as, that allows us to bend, twist, and move with ease. But unlike most tissues in the body, spinal discs are avascular. And that means that they lack a direct blood supply. So the big question is, how do these discs get their nutrition and the nutrients that they need to stay healthy, function properly, and also recover? So today we're going to deep dive into the physiology of spinal disc nutrition, focusing on how discs receive their nutrients, the role of diurnal disc changes and disc hydration changes, and how the end plates facilitate the transport of essential micronutrients and molecules. And most importantly, we'll discuss the practical and simple ways that you can help improve your disc nutrition to reduce the risk of disc issues and help heal disc injuries. So make sure you stay around to the end because that'll be coming through at the end. So let's get started with firstly how the discs receive nutrition. Now, the intervertebral discs are made up of two main parts, and that is the nucleus pulposus, which is the gel-like center. It's sort of like a thick, heavy phlegm is the consistency it resembles. And then we got the annulus fibrosus, which is the concentric rings of collagen fibers that encase or surround the disc itself, or the nucleus itself. And they provide the structural integrity. Now, if you want a little bit more deep dive specifically around anatomy, I recommend going and checking out our first episode where we talk all about the structure and how the discs are made. But for this topic, we're not going to go too much into detail into the anatomy of that. But if you're more interested into it, go and check out that first episode. Now, since discs lack direct blood vessels, they rely on diffusion and osmosis to receive nutrients and expel waste. Now, this exchange occurs primarily through the cartilaginous endplates, which separate the disc from the intervertebral bodies below and above. So the key mechanisms or how this actually happens is firstly diffusion and osmosis. The nutrients, particularly glucose and oxygen, diffuse from the blood vessels into the vertebral bodies across the end plates and into the disc matrix itself. This passive process, because it's passive, it doesn't require any specific energy, like from your mitochondria and your ATP, which is good. But this passive process is essential for disc cell metabolism and maintaining the structural integrity of the extracellular matrix. Then the second component of this is mechanical loading and unloading. The movement of fluids in and out of the disc is facilitated by mechanical loading cycles, and we'll discuss this more in detail in the middle of this podcast. But when the spine is compressed, such as when we're standing or sitting, waste products are squashed out, they're expelled, and when the disc is unloaded, recumbent positions or lying down, nutrients are drawn into the disc. The efficiency of these processes is highly dependent on the permeability of the end plates and the overall health of the disc tissues. So if the end plates become damaged or calcified, then nutrient flow can become disrupted, which may lead to degenerative changes in the discs and also impact on the nutrient supply that the disc will actually get. So firstly, in terms of the fluctuation, I want to touch on the diurnal changes in disc hydration. So one of the most fascinating aspects of disc physiology is how hydration levels fluctuate throughout the day. And that's a process that we call diurnal variation. So at nighttime, what happens is when we sleep and unload the spine, so lying horizontal, the discs absorb fluid via osmosis, increasing their height and their volume. Now, this occurs because the compressive force that normally squeezes the fluid out of the discs are absent, right? Because if we're lying down horizontal, gravity works vertically and we're horizontal, so we don't get that direct compression or vertical compression on the discs from gravity. That's number one. And then your muscles that hold you up against gravity, spinal muscles and stabilizing muscles, don't have to work as much, or not really any, because you're again horizontal. So then they switch off and then they don't actually contract and compress the spine. So that compressive force is reduced. Now, research shows that discs increase in height by approximately 1 to 2 centimeters overnight. And that's due to fluid absorption. And this is, countless studies there. For example, Riley et al. In 2009 and Jansch et al. In 2020. Now, this hydration process is essential for restoring disc health and ensuring that metabolic byproducts that accumulate during the day are removed. So the osmotic gradient between the disc and the surrounding blood vessels drives nutrient influx, meaning that it draws in those all those good nutrients that we want, and that replenishes the disc's supply of glucose and oxygen and other important molecules. So that's at nighttime when we're lying down. Then in the morning, we have fluid expulsion due to spinal loading. So upon waking and weight bearing, the spinal disc gradually expels fluid from the actual disc itself, and that's due to compressive forces that actually push down and literally push out some of that fluid out of the nucleus pulposus and then out of the annular fibrosis, the outside covering those fibers. This process reduces disc height and increases stiffness as the day progresses. Now, more than half of the day's total disc height loss actually occurs within the first hour of upright activity. And the disc can lose up to 10% of their height in that first hour, which is quite incredible. Park et al. In 1997 showed this, and same thing with Riley et al. In 2009. And that's quite a significant fluctuation. Then over the rest of the day, over the full day, disc fluid content may drop by approximately 20 to 25%, depending on the activity that you're doing and the loading patterns that you're doing. And this is, again, shown by different research, Botsford et al. In 1904, McMillan et al. In 1996, for example. And the expulsion of the fluid helps to remove the metabolic waste products, right, such as lactic acid and other byproducts that we don't want to hang around there too long, which, if they do, would otherwise accumulate and contribute to the degradation of the disc tissues if not properly cleared out. So to summarize that, it's an important process, as we were saying, where you have the being horizontal, right, and unloading the spine, and then that allows the osmotic pressure to absorb the fluid and the molecules that it needs to absorb over nighttime to feed the disc. And then when we get up in the morning, we have that compressive force coming from gravity and also from the muscles contracting and compressing the spinal muscles, which is a good thing. And that helps to squash out or expel and push out that extra fluid that's accumulated overnight. Now, why this matters so much is because bending stress on the discs will change during the different times of the day. So one of the critical consequences of fluid shift is the increased bending stress on the annular fibers, so that's the outside fibers of the disc, in the mornings. Now, research, particularly by McGill, found that annular fibers are subjected up to 300% more bending stress early in the morning due to the increased internal pressures from the overnight rehydration. I'm going to repeat that again. 300% more bending stress on the annular fibers. 300%, that's a huge increase, right? And that, again, is contextual to the person. But in this state, the disc is more susceptible to flexion type of injuries and bending type of injuries, such as, spinal flexion or bending under load, because we've got that increase in that fluid. Right? And that's where it creates more pressure at the back of the fibers. And if you've got disc injury already, but even if you don't, you've got an increased pressure on those posterior fibers of the discs. Now, there was a great study that was done by Snook et al., which demonstrated that when patients with chronic low back pain avoided spinal flexion movements during the first hour of their day when waking, they reported a significant reduction in symptoms. This shows us basically that to avoid bending excessively in the morning actually allows the disc pressure to get back to its normalized size and reduce that bending stress, right? So if we've got that increase in the fluid, and it makes sense hydraulically, we've got more fluid in there, it's going to act more hydraulically. And so if you're bending, the pressure on those fibers is going to increase. So it's important to understand these diurnal changes because it's crucial for optimizing spinal health. And this is where a lot of people with like disc bulges or herniations or disc-related issues often feel a lot of stiffness in the morning. And they often think that it's due to tight muscles. And unfortunately, they're told the same thing by the not informed clinicians. And they think, oh yeah, it's just tight back muscles. Go and do some stretches before you get out of bed. The common one I always hear is knees to chest stretch. Do some pelvic tilts. Do some knee rocks before you get out of bed. And that will help to loosen up your tight back muscles. that is so small-minded to say the least, right? And again, I always challenge my patients and say, well, we don't stretch your bicep. We use our bicep all day long, but we don't wake up and go, oh, my bicep's stiff. Let me stretch it out, right? And again, context, unless you've done like really heavy bicep workout and you've got some DOMs and all the rest of it. But besides that, normal day to day, we don't go, okay, I got to stretch out my bicep. Yet we go, oh, my back feels tight, let me stretch it out. And it's got nothing to do with those muscles in most cases, and contextual. It's got nothing to do with the muscles. It's actually the change in that pressure, the hydraulic pressure that increases in the disc. And as we described before, the pressure on those annular fibers when you bend is actually way more. And so if you're doing stretches where you're putting the spine under flexion, it's probably not the best way to go about it, because it's going to just irritate those tissues and irritate the annular fibers and keep things sensitized. So this again is why it's so crucial to identify and understand the mechanisms of injury and mechanisms of pain, particularly with lower back and spinal issues. Because understanding these various mechanisms and the processes are key to rehabbing these issues and help to maintain dysfunction and longevity. Right, so it's important. So now we understand that, let's move on to the role of the end plates in disc nutrition, because this is really an important factor and something that's not very heavily discussed, but needs to be discussed more. And that is the fact that the cartilage end plates are the primary gateway for nutrient transport into the disc. These structures are semi-permeable, as we said, so they act as semi-permeable barriers that allow essential nutrients to diffuse while simultaneously removing metabolic waste. Findings from the ISSLS Prize in Clinical Science 2025 was a good research paper that highlighted that cartilaginous end plates that have defects, the defects often precede the bony end plate defects and are a key driver of early disc degeneration. That's what this study sort of reported and found. So to make this concept more clear, findings from that 2025 prize-winning study showed that the first thing to go wrong in early disc degenerative changes is usually the cartilaginous end plate, not the bone or the disc itself. So in simple terms, the cartilaginous end plate is like a gateway, as we said, or a sponge that lets the nutrients into the disc. Now, if that becomes cracked, brittle, blocked, or damaged, then the gateway stops working as well, right? Makes sense. Less efficient. So without those nutrients coming in as efficiently, the disc starts to have changes that occur to it, and it can actually start to weaken to a certain extent. And eventually the bone underneath the cartilage, the bony end plate, also begins to see changes. That's where we can have things like modic changes, as it's called, or even end plate disruptions and fractures of the actual cartilaginous end plate, and then eventually the bone itself. Now that means that early problems with the cartilage, the end plate, is almost a warning sign. And catching these changes early may be able to help stop or slow the degenerative processes that take place at the disc. So let's quickly talk about the physiology of healthy end plates. Healthy end plates contain highly porous cartilage, which enables efficient exchange of the glucose and oxygen and amino acids, right? So that cartilaginous end plate, the matrix there, has the blood vessels, has the top of the nerves that come through the basovertebral nerve, and that allows, again, the exchange of all the essential things that we want the body to actually absorb. So things like glucose, oxygen, amino acids. They're also relatively adaptable because they are softer, like, as we said, the cartilage. They're not as hard as cortical bone. And so they can sort of remodel in response to mechanical stresses to maintain optimal nutrient diffusion. So the composition of the end plates ensures that nutrients reach the inner regions of the disc, which again don't have direct blood supply, where cell density is lower and direct diffusion would otherwise be ineffective. So it's very, very important. Now, in that study that I spoke about, they found that micro cracks and defects in the cartilaginous end plates reduce the permeability. Right, so that starves the disc of essential nutrients, and as a result, cells within the nucleus pulposus can become hypoxic, meaning that they don't have sufficient oxygen, leading to a decrease in the matrix synthesis and an increase in the catabolic activity. So that's where things start to get broken down. Now, over time, the compromised end plates can lead to progressive disc dehydration. So that's often where you see in reports that I see with patients all the time. They'll get MRIs or other medical imaging, and they'll say disc desiccation. And that means that there's a loss of water content. And then also say, reduced disc height or degenerative disc changes, which again is very open-ended term, and we don't really like to use that because we like to be more specific. But that's what they're talking about. It's the disc dehydration, the loss of height, and then the reduction in the structural integrity of the disc. And this is or can lead to an increased risk of disc injuries like herniations and degenerative changes and processes of the spinal discs. So a very important part, and that's why it's key to highlight that importance of that end plate. So optimizing disc health as much as we can. Now, given what we spoke about before and what we know about the nutrient transport and the diurnal hydration changes, as well as the end plate integrity, how can we protect our spinal discs, right? So I'm going to run through some strategies for maintaining healthy discs. And the firstly is optimizing loading cycles. So with this, we want to try and avoid excessive spinal compressive forces, particularly early in the morning, as we spoke about before, when the discs are highly hydrated and they're more vulnerable to that bending stress that we spoke about. So incorporating gentle controlled movement early in the day to facilitate that fluid exchange without excessive stress. To be clear, I'm not talking about necessarily huge amount of stretching, mobility exercises. It's more about just normal human movements like walking, changing positions, etc. That gentle controlled movement will actually help to gently expel some of that extra liquid that's accumulated. And that's why with a lot of my patients, if you're listening to this, you'll know exactly what I'm talking about. We call it the morning routine, right? So that first 45 minutes to an hour in the morning, we're going to try and limit that flexion, limit that bending, and get in some of that normal human movement that can help to expel the extra liquid that's accumulated overnight. Next step is enhance end plate health. So if we can build structural integrity by enhancing the surrounding musculature, particularly the core as people call it, and the posterior chain, this can help to reduce excessive disc loading. And that's where we also want to work on what we call movement proficiency, which is moving efficiently, particularly in the lumbar-pelvic region, how the spine and how the hips are designed to move. We also want to try and avoid prolonged sitting and static postures, because frequent postural changes can help to maintain that end plate permeability. If we directly static compressing, and that's why sitting for an extended amount of time, we don't necessarily like to see too much of it. However, unfortunately, the way society is these days, we all, myself included, do too much of it. Driving, sitting at work, in front of the desk, sitting at home watching TV, and so we're changing that position. We actually spoke a little bit about this with our previous podcast with Dr. Jerome Fryer, where we spoke a little bit about this and his chair care exercise, which is a nice, easy way just to change that loading and unload the spine. If you haven't checked out the episode, highly, highly recommend going and checking that one out. Jerome is fantastic and super knowledgeable and super, super switched on guy. And we spoke more about that, so go and check that out. The next point is to improve disc hydration and nutrient exchange. So we want to maintain proper hydration to support diurnal fluid exchange. And we also want to engage in low impact rhythmic activities like walking or swimming. And that's what we'll touch on in a second, which promote diffusion-based nutrient transport. So that's cyclical compression, which we'll discuss in detail. Super, super important. And then we also want to try and manage or minimize the high impact stress on the end plates. So limiting repetitive heavy lifting too soon, too much in a row, particularly with poor technique, can also cause those micro fractures of the end plates. And that's where, again, context is important. But some of my heavy power lifters and strong men and women that I work with, when we're training super, super heavy, we've got to make sure that we deload the spine for those following days. So if you are training heavy, like Monday, Tuesday, Wednesday, Thursday, Friday, and then taking off Saturday and Sunday and then repeat, that direct compressive force can be too much, right? And you're going to start to see those changes occur in that end plate. And as we said, it's important to try and keep that integrity of the end plate and functioning well to deliver the nutrients and also help to expel the waste products. So it's very important. And that's why if you look at elite powerlifters, they're very structured in their training, and they're not training heavy every day. Maybe training heavy once every 4 or 5 days with a specific lift, right? And so that's where the key is. We don't want to overload too quickly, too much without deloading the spine, because that's where we can get those changes occurring in the disc and changes occurring in the end plates, and can lead to maladaptive processes that those discs and the lack of nutrient supply that those discs can incur. Now, final point that I want to touch on, as we said, is that cyclical compression and disc nutrition. So one of the most evidence-based strategies for improving disc nutrition is cyclical compression. So that alternates between loading and unloading of the spine through gentle, repeatable, and controlled movements. So there's a whole list of studies, including Urban's work, et al. In 2004, Wilkie et al. In 1999, and then, as I said, Fry's work in 2010, show that cyclical compression enhances nutrient transport by creating pressure gradients across the end plates. And that promotes diffusion of glucose and oxygen into the disc and the removal of the waste products. So with that, activities like walking, which helps with gentle loading and unloading. So every step that you take, when you land, you get that cyclical compression. And then as you push off, we're actually very, very short bursts of it, but actually that spine is just unloaded as you sort of, alternating between one leg and the other. When you land, you get that compression. And then as you push off, we have that little momentary weightlessness that we have. And that's where that spine just gets unloaded. So it's the loading and unloading that helps to create that beneficial cyclic loading without directly overloading the discs. Now, for example, Urban and colleagues demonstrated that cyclic loading increased the transport of small solutes into the disc by up to 50% compared to static conditions, right? And this just goes again to show the importance of movement in disc health, but correct movement. So that's where that cyclic, not overloading, but just that gentle. And it goes back to, where my one that I always reference to, and I heard it from Joel Proskowitz, who's a friend and colleague of mine, and again another brilliant clinician, said that the only true form of exercise that humans were designed to do is walking. Everything else is made up. That's how I love how he terms it that way. And that's because it just does such brilliant things for the spine. So that's why, again, we like that usual, as we term it, human movement, where you change positions, and walking is just brilliant for the spine. For those who can tolerate it, it's just one of the best things, if not the best thing that you can do for spinal health. And it's primarily due to this, as we're speaking about, which helps with the transport of those solutes, getting the discs the right nutrition, helping you to expel the waste products. So if you take home only one thing from this episode, it's to do more walking. And again, it doesn't need to be huge amounts, just little bits throughout the day. So instead of doing one big, massive amount, I like to say lots of small doses throughout the day. Okay, so to wrap it all up, spinal disc health depends on the efficient nutrient transport, proper end plate function, and balanced mechanical loading. The latest research, including the findings from the ISSLS Prize in Clinical Science 2025, reinforces the importance of protecting cartilaginous end plates or cartilage end plates to preserve disc hydration and prevent early degenerative processes from occurring. So if you're dealing with chronic back issues, stiffness, disc-related issues, it's essential to address these issues by understanding them and addressing them early before they progress anymore, right? As the saying goes, prevention is better than a cure. So that's where, we pride ourselves at Perth Injury and Pain Clinic, and myself in particular working the spinal, is being very comprehensive in our spinal assessments and personalized rehabilitation strategies aimed to support the disc health and the spine health and improving long-term outcomes. So we place a really strong emphasis on understanding the biomechanics, the physiology, and the latest research around spines and spinal discs, including disc hydration, nutrition, end plate health, movement strategies, all that stuff that we discussed. So we can actually help you guide yourself towards a more effective and lasting recovery solutions, right? And that's where, again, there's a very, very hotly contested discussion around, do discs adapt? And there's a lot of great research out there that supports all this. And again, we can't cheat physiology, we can't cheat biology, we can't cheat physics. And so if we understand these, that's where we can actually make the appropriate changes to get people injured from their recovering from the injury and getting them back to doing what they want to do as well. So hopefully you've taken away a bit more information, understand how discs are so different to other tissues. Because of that, they don't have direct blood supply, they're avascular, and so as with that, they undergo a different way of getting their nutrients and therefore a different way of healing. And so it's important to understand this. And if you are with a clinician who doesn't know any of this, then probably time to find a new clinician. But that's it from me for this episode. Hopefully you found it informative. And as we always like to say, keep healthy, keep learning, and keep doing what you love.